Thank you everyone for joining us. My name is Alberto Diaz-Calleros. I am the director of the Center for Latin American Studies at Stanford University. Today we are, it's my great pleasure to have an esteemed colleague and somebody whose work I really admire, Ana de la O from Yale University. But before I introduce her, I do want to tell you a couple of housekeeping matters. This is a webinar, Zoom webinar, so all attendees are on listen-only mode, and only the speakers will be able to share their videos. If you run into any technical difficulties, if you are on the Zoom chat, please send us in the chat a question or some message so we can help you log in or get in. The lecture portion of this webinar is being recorded, not the Q&A, and it is being live streamed on our class YouTube page. And if you have questions, you will be able to ask your questions, and we will have a session of Q&A, but that will not be live streamed. All webinar attendees are muted, but please do send your questions through the Q&A button throughout the webinar, and I will read the questions to Professor de la O. I do want to remind us that we are in native land. Here at Stanford, we're in the land and the territory of the Ohlone original peoples. We offer gratitude to the land, to the water, and the air that surrounds us, and we pay our respect to the past, present, and future Ohlone and Lenape peoples who continue to be present in their homelands and throughout their diasporas. Please support indigenous organizations, donating your time, your money, and try to learn and encourage others to learn something about our indigenous-led grassroots movements that are happening everywhere in your surroundings, both in Latin America and North America as we speak. I also want to thank Stanford Center for Democracy, Development, and Rule of Law for being a co-sponsor of this book talk by Professor Ana de la O. She will be talking about her book, Crafting Policies to End Poverty in Latin America. Ana de la O Torres, Ana Lorena de la O Torres, is an associate professor of political science at Yale University. She's also affiliated to the Macmillan Center for International and Area Studies, the Institution of Social and Policy Studies, and the Jackson Institute for Global Affairs. Her research deals with various problems related to the political economy of poverty alleviation, clientelism, and the provision of public goods. She has done some of the most innovative experimental and also non-experimental work trying to tease out some of these issues. She's the author of this book, Crafting Policies to End Poverty in Latin America, published by Cambridge University Press, and she has published in many of the top journals in our discipline in political science, including the American Journal of Political Science, the Journal of Politics, CPS, a Quarterly Journal of Political Science, etc. She earned her PhD in political science from MIT in 2007. So please, Ana, the floor is yours.
Thank you, Alberto, for that very generous introduction, and also for inviting me to this seminar series. And I want to particularly thank you for suggesting that I take this opportunity to talk about my book, and also to reflect about what lessons we can draw from more than 2 decades of fighting poverty with cash transfers in Latin America. I think it's a great moment to sort of take stock of the kinds of policies that have been implemented in the region and reflect about where are the areas of improvement. And certainly with COVID-19, as we all know, the issue of how to build better social assistance and social protection programs is again a priority agenda. It's quite shocking that COVID-19 has managed to reverse the steady progress that the world had made in terms of reducing the number of people that are living under the poverty line. So as UNDP has shown, for the first time, we see an upward trend in poverty rates, in the global poverty rates. And in Latin America, we see similar trends. So the region had made quite substantial progress in terms of the fight against extreme poverty, but the rate of progress had been already reduced with the end of the commodity boom. But and even before the COVID-19 crisis, 23% of people in the region were living under the $5.5 a day poverty line. And according to some estimates by Nora Lustig and her co-authors, it's very likely that more than 25 million people are going to fall in poverty after this health crisis. So it is definitely a priority to figure out sort of what can we do. And what I'm going to do in this talk is give you a sort of brief overview of my book, Crafting Policies to End Poverty in Latin America. And what I'd like to do is zoom in with just 3 findings of the book, just to give you sort of a sense of what's in the book. These 3 findings basically strongly suggest that the policy design and implementation of poverty relief programs differ systematically when presidents who are designing them and rolling them out face checks on their authority compared to when they don't. And then second, I want to show you that robust and politically insulated programs survive longer, and that when CCTs have strict designs, they can undermine clientelism. And then I will zoom out and talk about some of the lessons that I see coming out from the experience of cash transfers in Latin America. So that's where I am going. And maybe it's funny because when I started thinking about cash transfer programs, these programs were innovative, they were very fresh. And now when I talk about cash transfer programs, I feel like I'm talking about history. So that just tells you how fast time goes by. But in the 1990s, CCTs were considered as very innovative poverty relief programs. And the innovation was that these programs combine cash transfers directly to households with behavioral conditions that encourage parents to invest in the education and the health of their children. These programs became very popular very quickly, and both governments from the left and the right wanted to adopt a program like this one. And currently, 127 million people in Latin America receive a cash transfer of this type. Now, my book focuses on perhaps an understated breakthrough in this wave of social policy reform. And that is that some governments adopted programs with operational guidelines that limited the ability of politicians to manipulate these programs for political gain. So, for example, in some countries, these programs include fixed eligibility criteria, monitoring systems, independent evaluations, whereas in other countries, these programs look like what we would call clientelism, or programs where clearly benefits were distributed in exchange for political support. So what I try to do in the book is try to explain why this happened, and then what are the implications for this type of variation for the welfare and political lives of poor people. The research design in the book combines both quantitative and qualitative work. So I have case studies of Mexico, Colombia, Peru, Guatemala, and Argentina. And in these case studies, what I did was go through the debates in Congress to figure out what were the dynamics between executives and legislators when these programs were being designed. And then the book also draws on a data set of the adoption and the design and implementation of these programs. And for this, I went through the operational rules of more than 20 programs that had been implemented in the region for about 2 decades. And then I take advantage of within country variation in Mexico. And for this, I collected with some colleagues a nationally representative survey, and then I explore the downstream effects of the experimental variation created by the Progressas evaluation that was conducted early on in the program. The first thing that I guess my book does is to discover that there was variation in the design and in the implementation of these programs. And on one hand, we have programs that have very strict operational rules, like Progresa in Mexico. This was the original name of the Mexican CCT, and this is just a flyer that was distributed in early waves of implementation of the program. And the legend in this flyer says, Progresa is not sold and is not exchanged for votes. So that is one extreme. In the other extreme, we have programs like Bolivia's Juancito Pinto. And Juancito Pinto's was a program that was implemented by Evo Morales. This program was basically a scholarship that the military delivered to students in their schools twice a year. And interestingly, this program saw its most massive expansion in 2008 that coincided with the referendum that ratified Evo Morales' administration back then. So you have these two extremes of programs. What I do in the book is go more systematically to try to score the operational rules based on the design and then on the implementation. And there are 6 dimensions which I study that go from whether programs use targeting and whether that targeting has clear rules to decide who is eligible and who's not eligible to be in the program, whether the cash is conditioned on parents sending their kids to school or to health centers for regular health checkups, whether there are operational systems in place to monitor how the program is being implemented, and whether there are any measures to make the operation of the program transparent, whether there are independent evaluations conducted of the program, both national and international evaluations, and finally, whether there is a clear exit strategy for families, or in the jargon of these programs, whether there is a graduation strategy that makes it very, very clear when programs become ineligible to continue in the program. So what you can see in this figure here is that there's quite a bit of variation over all of these programs. To explain this variation, I build on prior work that has already shown that economic crisis opens a window of opportunity for pro-poor policies. And here I am also building on Alberto, Beatriz Magaloni, and Federico Esteves' work on Mexico. They have shown very clearly that a big part of the story behind Progresa is in fact the economic crisis and the aftermath of the lost decade. My contribution is to argue that legislators' resistance to the president actually influenced the policy design and implementation of these programs. And I'll talk a little bit about that in a second. But the basic story that I'm telling in the book is that when presidents face resistance from legislators, they were better off tying their hands to guarantee the budget for these programs. But when they did not face resistance from legislators, then presidents didn't need to tie their hands, and they ended up creating and implementing programs that were less strict and more politically vulnerable to manipulation. So the consequences of this is not only that the design and the implementation are effective, but also the expansion of these programs are affected. So in places where you have presidents that have tied their hands, there are less political business cycles with the enrollment in these programs, and programs are more likely to survive because they have not been politicized. Now, if we follow this causal chain down the line, the last thing that I show in my book is that when you have a program that is implemented in a strict way, then that can undermine clientelism. And interestingly, the incumbent can still get some electoral rewards from this, but it's a very different type of effect than the pure clientelistic effect that we very much know has happened in Latin America in many points in time. All right, so, I don't know why it started again. Okay, so now I want to zoom in into the key findings of the book. Oh. Oh, here, I don't know why. All right, so the first key finding, sorry about that. The first key finding of the book then is that policy design differs systematically when presidents face checks than when they don't face checks. And for this, as I mentioned, what I did was first go to the parliamentary debates in each country to figure out what were the dynamics between the executive and legislators. And then I use my data set to figure out whether this works with sort of standard measures of divided control and checks on the president. And what I do is put all of this together into an analysis where I have here as dependent variables whether countries adopted a CCT with a design that is above the mean, or it makes a little difference if you use the actual design score, which runs from 1 to 6. And what I'm showing you here is that actually having a government divided, that is that the president does not control a majority in the Congress, actually increases the probability that a country implements a CCT with an above mean design by 19 percentage points. And it increases the design score of these programs by 6 percentage points. And these results are robust to whether you use this measure of divided controls or whether you use checks on the executive as a measure of how much resistance the president was facing in Congress. It's robust to including or excluding controls, and it's also robust to using an empirical design that's in the spirit of a regression discontinuity design. So comparing presidents that won a majority in Congress by just a small share to presidents that lost the majority of Congress by just a small share. So these results are quite robust to all of this. And what these results are sort of picking up is this dynamic of legislators pushing back on the executive. And just to give you a little bit of sense of how this played out in Congress, so this is a quote from the Minister of Finance in Mexico, 1997. This is a point where the PRI, which was an hegemonic party in Mexico, no longer controlled the lower house of Congress. And this is the Minister of Finance saying to legislators that they are going to submit to the consideration of the lower house of Congress that Progresa continues its enrollment, but they promise that they're going to continue to select localities based on objective poverty criteria and that this selection is independent from political considerations or discretionary choices. And on the other extreme, this is a quote from a legislator, an opposition legislator in Argentina. And what he's saying is, it is evident that in this budget, we're missing the opportunity to change the trend towards social programs that directly transfer income in a transparent way with clear criteria to allocate the benefits. So this is basically sort of illustrating what these numbers mean in this table. Now, the second key finding that I want to highlight today is that this dynamic and the design that these programs have end up having real consequences in terms of the expansions of the program. So what I'm showing you here is an Euler's regression where the dependent variable is the fraction of households that are enrolled in the program in a given year. The independent variables are, again, whether the president controls Congress, whether there is an executive election, and then the interaction of these two variables. So if you see the coefficient associated to the executive election, then what you can see is that in absence of a divided government, these programs are expanded by 24 percentage points in an election year. But if there is a divided government, then this effect cancels out. So I think that this gets to the point that when there is resistance from Congress, then presidents need to tie their own hands to make this happen. Now, I have to say that this argument that I'm making here is not an obvious argument, because if you think about it, there are some scholars that have argued that legislators in Latin America have been for a long time, or for a long period of time, were rubber stamps of the executive with little power. Now, on the other hand, there are other scholars that have argued that actually a divided government creates policy paralysis. And what I'm arguing here is that in the particular domain of social assistance, what a divided government produces is not policy gridlock, but policy insulation. And importantly, this is happening not because the executive wants to tie the hands of the next administration, but they are tying their hands as transfers for all the innovation that they had in many parts of Latin America were not legislated as entitlements. And so this means that every year, presidents had to negotiate the budget for these programs in Congress. So I think that that creates the type of dynamic that I'm describing here, that presidents had to make policy concessions to guarantee the budget for the programs. So in terms of policy outcomes, the last thing that I want to show you is that this has consequences for the survival of these policies. And maybe we're all familiar with the phenomenon in the region that every time there is a change in administration, the new administration wants to kill all the programs of the previous administration. So this is particularly relevant for cash transfers because, of course, as I said, the cash transfers can create a pro-incumbent effect. So it's crucial to understand, well, when do these programs survive longer? So what I'm showing you here is an survival analysis. So here the dependent variable is whether the program survived over time in this period of 15 years. And I'm showing you the effect on the survival rates of having a president that faced checks on its power compared to a president that didn't. And these results do not change if I use divided government. But what this is clearly showing you is that when presidents do not face checks, so that's the blue line here, the probability that a program survives falls quite quickly compared to the probability that a program survives when the president faces checks on their authority. And the argument that I'm making here is that this effect, what explains this effect is how insulated the program is from political manipulation. All right, so the last thing that I want to show you, just in terms of some of the findings in the book, is that when you have a program that has a very sort of strict design and is insulated from political manipulation, then that can erode clientelism. And what I have here is a quote that a PRI broker told me in August of 2005. And he was pretty blunt about it. When we were talking about Progressa, he mentioned that what the staff of Progressa don't get is that they have to let us decide who enters and exits the program. Otherwise, we can't punish people that didn't vote for us. So he was very, very blunt about this, that the operation, the usual operation, clientelistic operation, was very much undermined by the implementation of Progressa. And to get a little bit more evidence about this potential effect of the Mexican CCT, I collected a survey with some colleagues. This is a nationally representative survey that had an oversample in rural areas. And we asked in that survey a battery of questions about vote buying and people's perceptions of whether they felt free to vote for whoever they wanted or whether the vote was secret, etc. And what I'm plotting here in this figure are the effects of people being enrolled in the CCT. And in this specification, I also had independent variables of whether people were enrolled in, for instance, the Seguro Popular, the sort of health insurance. And I'll show you a bit more about that in a second. And I had an independent variable that captured whether people were enrolled with other types of programs implemented by states and municipalities. So this is just the effect for the CCT. And what you can see here is that people who were enrolled in the Mexican CCT had a lower probability of saying that parties always buy votes in their community. They had a slightly less chance of them receiving an offer of a patronage job. They were not more likely or less likely to being threatened that the program would be discontinued or that they would be kicked out of the program if they didn't vote for a particular party. And this is a quite important null effect in a way, because one of the main sort of criticisms of these programs is that brokers can use them to threaten people if they don't vote for their candidates. There is no statistically significant difference on whether people received a gift or were offered a favor in exchange for their vote. And they are more likely to say that they think that voting and that their vote is secret, and that they felt free to vote for whatever political party they want. And sort of thinking about these results, one potential sort of critique that you might have is that maybe people don't feel comfortable saying that they sold their vote to a political party. It's an important sort of criticism to deal with. So in the survey, what we did was include a list experiment to measure the incidence of vote buying. These list experiments, what they do is grant a certain degree of anonymity to respondents to report sort of sensible behaviors. What this basically does is it gives us an estimate in the aggregate of the incidence of vote buying. People in the treatment group are given a list of activities that parties usually do, and one of those activities is offering offering gifts or favors in exchange for votes. And in the control group, we don't have that particular item listed. And respondents are asked to report only how many items they have seen parties doing, not which ones. And so here the idea is that people can report that they have seen vote buying, but without saying to the enumerator, someone offered me money for my vote. And then to figure out the incidence of vote buying, what we do is compare the averages in the treatment and the control group in the number of items that people report. And that's the table that I'm presenting to you here. So the first line is for people who are enrolled in the Mexican CCT. The second line is people who are enrolled in Seguro Popular. The third line is people who are enrolled in other programs run by the states or the municipalities. And then the fourth row is people who are not enrolled in any of these programs. And in the last column here, you have the difference between the treatment and the control. So one way to interpret this is that people who are enrolled in the CCT do not report vote buying. So there is no statistically significant difference between treatment and control. People who are enrolled in the Seguro Popular, likewise, do not report vote buying. But people who are enrolled in state and municipal social policies report a really high rate of vote buying, a 46% rate of vote buying. And people who are not enrolled in any program report a 25% incidence of vote buying. So just going back to the argument that I was making, sorry, and just to clarify, this is data from 2009. So in 2009, the way that program, the Mexican CCT, was operating, we have this evidence that the program eroded clientelism. And I'm happy to talk maybe in the Q&A about the mechanisms that could explain this effect. But for now, let me move on to the last part of the talk. So now I'm zooming out, and I'm going to be talking about some lessons from CCT programs for the post-COVID-19 period. And the first one, and perhaps this one is it's a difficult decision is whether in the post-COVID-19 period, these types of programs should continue to be targeted, or should they move more towards a universal type of program? And here, I guess, reality it's really binding in the sense that just as in the 1990s, governments had few resources, right now governments are cash strapped. And so it's very, very likely that governments are not going to be able to fund a universal basic income type of policy. But the thing that I want to note here is that social protection is not the same as social assistance. And I think that maybe precisely because of the success of some of these conditional cash transfers, over the years, we forgot about this very basic fact that social assistance and conditional cash transfers cannot be a substitute for policies such as pensions or disability insurance or any other type of policy that allows people to cope with adverse temporary shocks. And what we see now during the COVID-19 crisis is exactly that. Countries did not have very good systems of social protection, and they are relying on the systems of social assistance to get some resources in the hands of people. But of course, there are many people that are falling through the cracks of social assistance, especially people who were not deemed poor or eligible to these programs are not in the list of recipients of social assistance, and they are falling through the cracks. So that's something to keep in mind, that going forward, it's very likely that the systems of social protection need a complete redesign, and we need to be very sort of creative about how to make the social protection systems more encompassing and probably more generous. But we also need to keep in place social assistance programs. And by this, I mean programs that are designed to deal with the fact that structural poverty is a trap. So one of the things that conditional cash transfers, I think, really made clear is that in order for structural poverty to be eradicated, we need to figure out a way to eliminate the intergenerational transmission of poverty. And for that reason, I think that governments will continue to sort of trying to figure out ways to design social assistance programs that reach the poorest of the poor. And CCTs have shown that there are many forms of targeting, and some of them are more effective than others. And one thing that I explore a little bit in my book is that household level targeting is not a silver bullet, and that actually for rural areas, it makes more sense to use geographic targeting. And that's because when using household level targeting, the differences between people who are deemed eligible and ineligible might be very minor, and that might create tensions within the communities. So in rural areas, it might make more sense to use geographic targeting. It's a bit more challenging to think about how to target resources in urban areas. And I think this is where COVID-19 is really highlighting that the challenges are massive. But one thing that CCTs have shown is that the state capacity can be built up. So CCTs require an immense amount of administrative capacity to target resources, to monitor conditionalities, et cetera, et cetera. But some of the countries that have implemented very strict programs build this capacity quite quickly. And here, the experience of Ecuador really speaks to this point. The early CCT that was implemented in Ecuador used self-targeting to identify the potential beneficiaries of the program. And they asked people to go and submit their information to churches, both Catholic and evangelical churches. They had to submit sworn declarations of their socioeconomic information, and then they were set up in a system that started distributing cash transfers. It turns out that that was a very bad system to identify the poorest of the poor. There was an audit of this system, and they found irregularities. They found that there was a lot of leakage, and they found that there were massive problems of exclusion. But interestingly, in that same country, very quickly they found out a way to operate a targeting system that worked much better. So they very quickly figured out how to implement a national income survey, and then use that national income survey to detect potential recipients. So the takeaway point here that I want to sort of leave with you is that state capacity can be built up. Okay, the second, I guess, point that is perhaps very important to reconsider is the generosity of cash transfers. And here's worthwhile to remember that CCTs were originally designed to compensate households for the foregone incomes from child labor. So the size of the cash transfer varied from 4% of household consumption in Honduras to about 20% of household consumption in Mexico. So I'm giving you this range to show you that in some parts of a region, these programs were far, far, far from generous, if anything. Now, there is no experimental evidence that CCTs have generated distortions on fertility rates or on labor supply. So I think that there is room to increase the amount of these transfers. I think that the original design was perhaps too conservative and was trying to just provide offsetting compensation for child labor. But there is probably quite a bit of margin to increase the amount of this transfer before hitting the point where you could create distortions on labor supply, for example. So that's something to consider. And this is another tricky one for CCTs, because as I have mentioned from the very beginning, CCTs were very appealing because they were adding these behavioral conditions to receiving the cash. And now we are confronted with the question of whether conditions should or should not be attached to these cash transfers. Currently, there are more than 150 million children living in Latin America, and almost half of them live in poverty. And what COVID-19 is doing is magnifying inequalities in general, and in particular inequalities in access to education. And during the health emergency, most of the countries that have a CCT have suspended the conditions, of course, for obvious reasons. But it's an open question whether these conditions should come back after the crisis or not. Conditions have some disadvantages, and that probably we have not studied in that much detail. Conditions, of course, are costly, and they give a lot of power to frontline service providers, both the health service providers and teachers, because they are the ones that sort of put a check next to households so that households can continue getting these transfers. And this is something that, by the way, it's very, very well illustrated in Alberto, Beatriz, and Federico's book, and they have really excellent qualitative work suggesting that this is a possibility, that frontline service providers could in some way abuse their power vis-a-vis the beneficiaries. Now, the interesting thing is that maybe these programs don't need to monitor these conditionalities. So there is some interesting experimental evidence showing that maybe these programs can, instead of having these hard conditions, they can just label the programs as programs aimed to increase education and health of children, and that works exactly as well as a CCT. So this is evidence that comes from a field experiment in Morocco. This experiment was carried out by Duflo and colleagues, and they show that basically these labeled CCTs are as effective as conditional cash transfers. Now, of course, there is the question as to whether these results are generalizable, whether this would work in Latin America too, so that those are all questions that need to be answered before moving in this direction. But it's certainly worthwhile to consider what else can be done with these conditions? And maybe here technology can really help us. So of course, technology can decrease the cost of monitoring if countries are going to continue in that route. But maybe there are other creative solutions that technology can help to try to move away from this enforcement of conditions and to move more into a model of encouragement of certain behaviors. So as opposed to going through the stick, going through the carrot to try to get the sort of best effects for children. All right, now a few words about the blind spots of CCTs, because I think, again, when these programs came to the scene of development, they were very exciting because they were basically a different approach to get resources in the hands of poor households. And the idea of going through the demand side of services such as health and education was quite exciting. Now, the problem with this model is that these programs increased the demand, but in many cases, the supply side of services did not improve. And so this is, I think, a big limitation for the effectiveness of CCT programs, because of course you can send your kids to school and you can send them to health centers, but if the services are of really bad quality, then the effects of the program are going to be limited. And the other very important blind spot of CCTs is that by definition, isolated communities were excluded from these programs. So communities that were very far away from health centers, that were very far away from schools, could not be enrolled in this program, and that's a quite massive blind spot of CCTs. All right, so two more things before I wrap up, and this I'm going to go over them a bit quickly, and they have to do more with the politics side of it. But the first, and I think probably this is quite intuitive, what this early wave of CCTs have very clearly shown is that the coalition in form of policies is larger when programs have clear rules of how they operate, of who's in and who's out of the programs. And here, what I'm showing you is again data from the survey that I collected in 2008. And we asked people what do they value in a poverty relief program. And I'm showing you here these results broken by income groups. And just for the sake of time, I want you to focus on this last line where you have the more than 12,000 pesos. So that line is comparing people who have that amount of income or more in comparison to the poorest of the poor. So people who have a monthly income of 0 to 1,500 pesos. And this is where we see the most stark differences in preferences. So the higher income people clearly like programs with rules, and they like programs that avoid clientelism. That's not so much a concern on the part of poor people. So just maybe the point to here stress is that the coalition to fight poverty will be bigger if rules are clearer. And finally, this is very last point, I promise. Current events in Mexico have clearly shown that programmatic policies should not be taken for granted. I talked a lot about the Mexican CCT and how the Mexican CCT was a star program. Well, it turns out that the current administration dismantled that program and was able to dismantle that program. And in its place, they now are running a series of social policies with less clear criteria. Even the way of identifying potential beneficiaries has changed. So the bureaucracy that was quite professional implementing Progresa, Oportunidades, Prospera, has been replaced by a new arm of the bureaucracy. This is a photo of the Servidores de la Nación, who even the Electoral Institute had to instruct the newly created Ministry of Wellbeing to take out the name of the president from the uniform of these bureaucrats. So just to underscore the importance of the political sort of dynamics that can lead to very different types of policies. The current president in Mexico has no opposition from Congress, and clearly he can now design social policies that are more vulnerable to being manipulated. So let me leave it there. Thank you.
Thank you very much, Anna. This is, I don't know how much people realize that this is such a light of optimism that you shed on us, and the possibilities of politics and the possibilities of checks and balances in crafting policies that make a difference in people's lives. There are a bunch of questions that are coming in. I will please just thank our listeners on the web, on the YouTube channel. And remind them that we will have another incredible scholar, Sandra Ley from CIDE in Mexico, talking about her latest book that's going to be on November 6th. So before I go to the questions that are from